I want us all to thank Christy again. This is a remarkable way to introduce us to this subject, and I was saying to her that I was really grateful she was coming up to speak immediately after the movie, because I don't know that I would have been able to for a couple of moments. My name is Lisa Cohen. I'm the Executive Director of the Washington Global Health Alliance. At this time, we'd like to open our panel discussion and the question and answer session. You should have all received a card in your program. Please pass your questions to volunteers in the aisles, and we'll get to as many of your questions as possible. This is going to be a short session tonight, panel session. I guarantee you that we could spend all day talking to these four people, these four amazing people. Please remember to write clearly and succinctly, and I'll get to as many of the questions as possible. We in Washington State, when I first talked to Christy about coming out here last June, I was telling her about how in Washington State we are blessed by a remarkable concentration of global health organizations. And we all are aware of the Bill and Melinda Gates Foundation and their leadership in this arena, but I want you to know that these efforts have been going on for decades, even before the formation of the foundation. And the panelists here, one of the best known global health organizations, I think now the fourth largest global health organization in the world, is PATH. Dr. Chris Elias is here. And also all of you in this community are aware of Seattle Children's, but you may not be aware of the role that they play on the global scene, the Global Alliance for the Prevention of Prematurity and Stillbirth, Dr. Craig Rubens. And then we're very fortunate to have Dr. Gary Darmstadt, who's the head of the Family Health Program for the Bill and Melinda Gates Foundation. I want to acknowledge we have three men up here, and but I want to also acknowledge that we definitely have a majority of women in the audience. And I want to thank Ann Stars from Family Care International, who told me earlier about a study that was released a few months ago that was measuring group intellect. And one of the biggest findings was that the more women you have in a group, the higher the intellect is, the more women engagement. So, more power to us. So, anyway, the representation here, along with Christy, is evidence of the tremendous talent we have in this state. And we're very fortunate to be the nexus for many global health activities and innovations. In fact, by some accounts, we have more than 200 global health organizations in Washington State. So I want to start the discussion tonight with Dr. Chris Elias, President and CEO of PATH. And I'm not going through their entire biographies because you have them in your programs. But Chris, we've seen very eloquently the human toll reflected in Christy's documentary. Can you give us some context for this problem and specifically around the idea that much of this is preventable?
Yeah, thanks, Lisa. And I really think documentary provides the best context. As somebody who's been working in the maternal and reproductive health field for 20-some years, I think the film vividly reinforced three things to me that I've known, but it brings forward in a real way. The first is courage. Poets and philosophers through the ages have written about women approaching and in childbirth as being the most courageous thing that people do. And I think some of the stories, particularly the first one, really captures that courage. The second is the injustice, and Christy summarized it in the numbers. When 1 in 22 women in sub-Saharan Africa run the risk of dying in childbirth compared to 1 in over 7,000 in this country, this is one of the most inequitably distributed problems on the face of the earth. And that's unnecessary. And so the third thing I think that Christy's comments in particular, as well as the film brought through, is hope. This is a preventable problem. 98% of this problem doesn't have to happen. But it's a challenging problem. It's a complex piece of getting families and communities educated to recognize the problems early, organizing systems of transportation where roads are bad and money's not available, and getting health services tuned into understanding women's perspectives, why they're afraid to go to a hospital, why, that Bangladeshi doctor who's well, what's she doing here? Why is she doing? And, you know, those kinds of quality of care, quality of service elements affect how this solution set is able to be delivered. And so, those are the things that rank forward for me, you know, the courage, the justice, and the hope, because that we can solve this problem.
And there is clearly a lot of hope, but there are a lot of complications as well. So, Dr. Rubens, Craig, can you give us a sense of why this is difficult?
Well, I think that, first of all, I want to congratulate Christy on creating a documentary that really touched on so many different issues. And maybe to the audience it would feel very complicated, but I'd like to reduce this a little bit to a simpler, maybe form of thinking, and that is that the problem we're all talking about right now is mortality. How can we stop the inequity and death in maternal mortality? And there are a lot of solutions, so the hope is that the solutions are there. But there's a complicating factor, and Christy touched on it in her eloquent talk afterwards, that women who go through complications during pregnancy, if they don't die, they have a high risk of some kind of complication, including losing their newborn. While there are 60 women that die every hour, there's 600 babies that die every hour. So the complication here is that as we think about how we can improve survivability of pregnancy and some of the complications, I would ask, what are we doing to prevent those complications from occurring at all? And I think that's where there is great hope. Because if we can turn the research community towards understanding why women have problems with infections during pregnancy, why they hemorrhage, which women are at risk, we have a great chance of preventing their need for complicated services to keep them alive. I think that's what hope is. And there's a lot of hope for those in the audience, those who are mature in their careers. There's a great opportunity here to do things that can make a difference through advocacy and making people aware of what's going on. For those of you who are young and are seeking your careers, there's a great opportunity in what we can do in trying to understand and prevent the complications of being a pregnant woman in this world, whether you're in the developed country or the developing world, and also in improving the lives of the families and the newborns.
Thanks, Craig. And we will we'll get into more about how ways that you can get involved as we go along. Gary, according to the recent data, and it was alluded to in Christy's film, and it's actually data that came out of the Institute for Health Metrics and Evaluation here at the University of Washington, there is progress being made. Maternal child deaths are declined, maternal deaths have declined. But is this problem solvable in an affordable way?
Yeah, this is a great question, and I want to congratulate Christy as well, because I think many of the solutions are really well illustrated in this film. And I want to first of all just highlight the numbers. You alluded to the fact that mortality for mothers is going down around the world. Actually, it's quite astounding. One of the greatest pieces of news that we got in all of public health, and certainly in my lifetime, has been the new news about how maternal deaths are going down. Since 1970, it's gone down in half from what it was over a 40-year period of time. Absolutely phenomenal. So we know that we have solutions that are working. Christy's film illustrated, as I said, many of the things that we know are going to work. I'll start kind of at the high level and kind of then work down, because we really need solutions at all levels. I'm going tomorrow to the state of Bihar, where that state has a new chief minister that has brought in new roads, transportation systems. He has cut down crime substantially in that state. And that's an example of some of the things that are needed for this problem to be solved. We need transportation systems and communication systems that can link mothers to the care that they need, and particularly in a timely manner, like was illustrated, particularly in the first case in Tanzania. We know that the empowerment of women makes a huge difference, and this plays out in several ways. One is that we know that when more income goes into the hands of women, they frankly spend it better. They spend it more for the betterment of the health of their family, and that translates into better outcomes for themselves as well as for their children. Empowerment also brings information about how to access care, information when to access care, information how to better take care of themselves and their children. I think that's a lot of what it boils down to. Several of the cases illustrated a really key role that we call a frontline worker. This is the person that the mother and the family first interfaces with in terms of seeking care. And that interaction that they have is really critical. You saw the example in Bangladesh where the woman was really concerned that she hadn't delivered the messages properly, and that resulted in the woman not seeking care in the way that they had hoped. And we know that this actually does make a big difference, really understanding where people are at, how they're living their lives, the barriers that they're facing, what do they need in order to overcome those barriers and seek care and practice healthy behaviors. So figuring out how to get that information and how to transmit it in a way that makes it acceptable, I think is a huge piece that's needed.
And Christy, when you were filming this, did you see a change, even a slight change in the women who were initially resistant to the advice of the community health workers? Do you think they went back and started talking about this more, or seemed to be a lot of fear there?
It's hard to say in a case like Bangladesh. We actually, she's gone back to the country, and so we've had less contact with her since. And I don't think that she's planning on having any more children, and I think she's actually in good shape to be controlling her fertility at this point. But in Tanzania, I can't tell. It's hard. I think Janet got that there was a randomness to it. I think a lot of people assume if you've had a couple of children that there's a lot of focus on the first pregnancy and the first child. But then a lot of times people think, okay, I've done this before. It'll be faster. I know what's going on. I know my body. I know how I can handle pregnancy. And oftentimes it's the second or third or seventh. I met a woman in Ethiopia last fall, and it was her seventh child that became the complication. And that's why you just need to be sure that you're linked to some sort of system. You need to be within reach of a clinic, and more importantly, you need to have some kind of plan in place so that if you are referred from the clinic, that you can actually get to your emergency